Hello, my name is Tony Millian, and I'm one of the managing partners of Practice Copilot. We're a company dedicated to using lean techniques to improve efficiencies and patient flow in different types of medical practices across the country. Today we're going to talk to you guys a little bit about an assessment technique that we use that focuses on trying to understand how patients are flowing through the office, and we use this technique to really understand what the current state of the office looks like before we try to make any improvements to the office. It's important to have something like this so that later on you can also assess how far your improvements have gone by really baselining what the current situation looks like. So this is really set up in the form of a routing sheet. And the way that this works, okay, is it's really a sheet that's going to be set up where you're going to take this and print out a few of them and put them at the front desk in your office. And the sheet is going to have some information at the top that's going to get filled out. Things like, something identifying the patient, maybe an ID number from the practice management software system, the date, which doctor that patient saw, what tech or medical assistant helped actually work up that patient, and then what type of exam that patient is going through. So remember, not all patients are created equal. Some types of exams take longer than others, and it's really important to be able to differentiate between those so that you can group them into categories and understand, what's the average for this type of exam versus this type of exam. And then at the bottom is really information about how that patient flows through the office. So the first thing you're going to do is you're going to fill in the process steps that that patient goes through from the moment they check in to the moment that they check out of the office. And then what's going to happen is as this sheet follows the patient through the office, it acts like a routing sheet. It would follow the patient through the office either on a clipboard or on the current documentation that follows the patient through the office. If you're paperless, like I said, a clipboard would work with, maybe a little stopwatch or timer at the top, so you can use that to track how long patients spend in certain areas. And what happens here is you're going to put in your start time of when that process occurred and your end time. So every staff member that touches the patient that's responsible for that specific activity would go in and insert their start time and end time for that specific activity. So one of the things that you'll see, for example, here where the patient checked in, it checked in between 8:45 and 8:47, and then the next process, this pre-test process, did not start until 9:13. So what that allows you to do is it allows you to capture the waiting time in between these processes as well, so you understand how long patients are spending waiting in the office. So finally at the bottom, what we do is we try to summarize two very specific things. How much waiting time do we have, and how much total door-to-door time, in other words, the time from check-in through check-out, is spent seeing that patient in the office. So again, you're going to see a lot of valuable information in here, specifically where patients are waiting, how long processes take, how long they wait in total, and what the total door-to-door time is for this process. So this is a really great tool to give you an assessment of what your current state looks like for patient flow. So what we'd like to do is offer you the opportunity to grab a copy of this form from us and go ahead and assess what patient flow looks like in your office. So if you'd like, please send us an email at info@practicecopilot.com or give us a call at 904-701-3084, and we'd be happy to send you this form, have you go ahead and collect some patient data in your office, and please feel free to share that information back with us. And what we'll do is we'll compile a benchmark of all the practices that we receive so that we can publish that information on our Facebook page and LinkedIn page, and you can see how you compare to that benchmark out there. Well, we look forward to hearing from you, and hope that you found this video helpful. Thank you.